Good evening. My name is Kerry Graves, and today I would like to talk to you about how ACEs can provide insight into trauma, and more specifically, how the ACEs questionnaire can provide insight into trauma. So, who am I? My name is Kerry Graves, and I am from Greensboro, North Carolina. I went to North Carolina State University, where I received a bachelor's in political science and criminal justice with a minor in history. And then I took a little bit of time to get to know myself and returned, finished that degree, and then embarked on a degree in which I achieved a BSW from North Carolina State University. Then I went on to advanced standing to achieve my MSW from the University of North Carolina at Chapel Hill, which is about 15 minutes from North Carolina State University. And after that, I went to the Universidad de Salamanca and took quite a few courses and received a certificate of intermediate courses in Spanish. Um, and so that is the extent of my degree work. But where have I been in my career? Once I finished my bachelor's degree, I worked at a group home and I saw firsthand the product of ACEs. And back then, I didn't know what ACEs was, but I was very interested in taking that a little bit further. So that's when I decided to go and get my social work degree. And after that, I became a child abuse and neglect investigator, but I also did some case management or treatment work. And I was also able to work in a particular county in their counseling department with children that had been abused and neglected and were in the care of the Department of Social Services. Years later, quite a few years later, I became the Child Welfare Collaborative Director at North Carolina State University and lecturer. And at this point, I recruited individuals into the program. I did budgeting. I was field supervisor for BSW and MSW students, and I taught three classes along with um, came up with a curriculum for one of the first curriculums at the university for uh, social work's sort of pre-hiring process. Due to budget cuts in the state at that time, I moved on to become the clinical instructor at the University of North Carolina, Chapel Hill, Jordan Institute for Families, Family and Children's Resource Program. And at that point, I was able to write, co-write trainings for the state. And we taught those trainings to social workers across the entire state of North Carolina. We had about 4 or 5 hubs, and they were from the coast to the mountains, north, south. And during this time, um, I was able to learn quite a bit about the process with curriculum review, curriculum implementation, policy writing, and currently I am a mental health psychotherapist, and I've been doing this job for 11 years now. So why did I choose this topic? I chose it for a variety of reasons, and one of those reasons is what I mentioned early on in this presentation, which was I've spent the better part of my career providing assistance to children and families in trying to help them achieve positive life outcomes. And I've been at the forefront within a few organizations of teaching professionals, social workers, law enforcement, education about child welfare and mental health. And one of the most important things that drives me is that, unfortunately, and in some respects, this might sound really odd. Fortunately, I've been a victim of a couple of different traumas, and I think I understand what it takes to smother those poor life outcomes and get on track. And that is my hope for everyone that encounters their share of ACEs. So it's embedded in me to do everything I can at this point to attempt to decrease ACEs for many, whether that's through lobbying, advocating, and my work in general when it comes to working with children and families. And so, in regards to my study topic, are children that experience ACEs more likely to experience poor outcomes, such as substance abuse, mental illness, poor physical health, and trauma as a result? And if ACEs were to be mandated, would ACE scores decrease over time, or would there be an increase in positive life outcomes? How does a high ACE score impact children over the course of their lives? And what are the societal implications of minimal screening for ACEs? Those are all questions that I think need to be answered. Keywords: ACEs, adverse childhood experiences, ACEs questionnaire, child development, child welfare, mental health, PCEs, positive childhood experiences, resiliency, toxic stress, and trauma were the key terms that I thought were very important to this research project. Key pieces of information: early life stress, such as abuse and other adverse childhood experiences, can cause brain dysfunction at an early age, hindering child development. So, when we look at ACEs and abuse, we have to understand that it's not just something where parents, caretakers have brought upon their children. This is also something that extends to their adulthood. Does this brain dysfunction, toxic stress stay with them throughout their lives? And if so, we've got a huge epidemic, and no one is really talking about it as being an epidemic. ACEs has a long-term effect on one's neurodevelopment, consequences of abuse and related adverse experiences during childhood. ACEs can affect one's neurodevelopment in the form of toxic stress, and I just mentioned that. And one of the most shocking key pieces of information that I've taken from this is the statistics that 64% of US adults have experienced at least one ACE. Over half of the United States adult population, which should scare us. And the more childhood exposures one has, the higher one's risk of health-related issues. And when we think about ACEs, we don't think about health-related issues. We just think about what can happen in the form of substance abuse or mental health, but not physical health. Other key pieces of information is that ACEs screening is not mandated. It's recommended in a variety of settings. And in some settings that deal with child welfare, ACEs screening is not even conducted. So, in my conclusion, it is very important that we gather a coalition of like-minded individuals, agencies, and organizations that understand ACEs and why ACEs screening should be mandated, as well as being able to assist in crafting solutions. We also have to understand and discuss, can we find legislators that truly believe in assisting children and families, which extends to ACEs and providing positive life outcomes? Some legislators talk about it, but they don't do anything about it. Some just ignore it and hope that it's going to go away. My concerns is that the North Carolina Department of Health and Human Services will downplay the importance of mandating ACEs screening, and they will go in a shell and fight it at every cost. And concerned that local county Department of Social Services will follow suit and not and see this as more work for an already overworked staff. In the relevant literature, my plan is to scour many databases in search of relevant literature, utilizing dedicated files for ACEs literature and expanding and updating my literature matrix, along with compiling a list of pertinent databases as well as those databases that are not of any use. That way I don't double back. So when it comes to ACEs, I will say this again. How does the ACEs questionnaire provide insight into trauma? That is the main question. Thank you.